This is an ABC podcast. Just a quick warning, there are sounds and descriptions of surgery later on in this episode.
When you take a deep breath, you can hear this rush of air going down into your lungs. And then your lungs expand and then you can hear your ribs creaking, and then the rush of air out. But then underneath that, you can hear your heart beating and you can hear your blood moving as well.
There's a condition you've likely never heard of, where the symptoms include hearing sounds like these, all from within your own body.
When you move your eyes, it's popping at the ears. That's what it sounds like. Your voice echoes back through your head all the time. And some days your knees and your feet, when you walk, you just don't want to walk because of the noise that comes back through your head. It's just unbelievable.
Oh, forget about stomach noises. That's just unbelievably yucky.
Superior canal dehiscence syndrome. That's to blame for this cacophony of sound. It's so bizarre and rare that most doctors haven't even heard of it, but it can have a profound impact on a person's life and mental health.
Some people can take 2 to 4 years to get diagnosed because if you go to a doctor and say, I can hear my eyeballs moving, most people think you're crazy. And so people start believing that they're actually crazy.
Hi, I'm Sana Kadar, and you're listening to All in the Mind. In this episode, we'll go into an operating room and catch a glimpse of the brain, all in a bid to learn about this little-known condition called superior canal dehiscence syndrome.
My name is Anne Miller. I'm a teacher in Bankstown. I suffered from a condition called superior canal dehiscence, which literally means that I had a hole in my head between my brain and my inner ear.
About 6 years ago, Anne started to experience the very first signs that something wasn't quite right.
I was feeling the vertigo and the dizziness, and then you just sort of ignore it. You just ignore it. And then what would happen is, being a teacher, you would go to school and there was so much noise going on and it was reverberating in my head. So when I went home, the first thing I could do was I would lay down on the couch and virtually put a pillow over my head because I just needed to be quiet. I just needed that silence, and my head was throbbing and I was feeling dizzy and disorientated and so on.
As the dizziness got worse, Anne's vision started to blur.
In order to walk down the corridor, and it's a long corridor as well, I had to put one hand over one eye because my eyes couldn't focus. I was having split vision and I had to put one hand against the wall, and it was like I was walking on a boat. The floor seemed to be moving.
On top of that, noises from inside and outside her body were growing louder.
Forget about going to dinner in a loud restaurant in particular. That was just hell for me. Eating was a bit noisy as well. Forget about apples. Soft food, mashed potatoes. That was great. But then my eyes couldn't adjust because every time my heart beat, my eyes would flick.
Oh.
And the vision would change and you go, oh. So
with every heartbeat?
With every heartbeat. So it was like, oh, wow.
As things got worse for you, how did that affect your mental health? I mean, obviously your daily ability to function was affected.
Oh, I thought I was fine.
Really?
I thought I was fine. Yes, because I'm on this side. But everybody else, my friends and family and my partner, they just thought that I was going crazy. I was getting irritable. My partner actually thought I was suffering from dementia because I could forget things because there was just so much going on and you couldn't concentrate.
Still, Anne didn't go to the doctor for a number of years. She worried no one would believe her symptoms.
You don't want to go to the doctor and say, I'm hearing noises, because you know that what's going to happen is the little man with the white jacket's going to turn and go, come this way. We've got a nice room for you. So I just sort of thought, well, maybe it would go away, because it would get bad and then all of a sudden the symptoms would die down a bit, and then all of a sudden the symptoms would come back, but they're now worse, until I reached a point where I just couldn't handle the noise anymore. Like, I've been teaching for a long time, but there came a day when there was a lot of noise in this class, and I found that I couldn't focus. I couldn't even get my mind to work, you know. It was just this cacophony of sounds and stimuli and things like this. And I just stood there virtually in the middle of the classroom, and I started to cry. And then I thought, oh no, I think there's something really seriously wrong.
Finally, 4 years after her symptoms first appeared, Anne went to see a doctor. And luckily for her, she wasn't written off as crazy. After conducting a few balance tests, the GP sent her off to see an ear, nose and throat, or ENT specialist. She also saw a neurologist, and eventually, Anne ended up at the offices of Dr. Tom Cortez.
My name's Tom Cortez. I'm an ear, nose and throat surgeon at Prince of Wales Hospital and Sydney Children's Hospital.
Dr. Cortez has been performing surgeries to fix superior canal dehiscence syndrome for about 20 years, as long as it's been recognised as a condition. Now, to understand where in the ear a superior canal dehiscence occurs, you need to know a bit about the ear itself. All of us have what's called the outer ear, middle ear, and inner ear. Your balance system lives in the inner ear, and it's made up of 3 canals that are semicircular in shape.
And they tell your brain where you are in space. They have fluid around them. And when your head moves or your body moves, the fluid around that balance system moves, sends signals to your brain, and we keep our balance by moving other muscles in our body.
The canal furthest to the top of the ear is called the superior canal, and it sits very close to the brain.
Normally there is bone over the top of it, 1, 2, 3 millimetres, which separates the brain from our balance system. And it's those patients that lose that plate of bone, and so the brain is now connected to the balance system, that have this syndrome. So when that bone is too thin, you now have a third outlet for sound and pressure to get out of the ear. The ear is normally a closed system. Sound comes in through the oval window and out through the round window, and it's enclosed in that system. Now with this dehiscence, you have a third window which allows pressure, blowing your nose, going on an aeroplane, straining on the toilet, to escape through that system. And the other thing is that you now hear your own physiologic sounds much more loudly, like your own voice. Often there's a pulse in the ear as well, and that can be extremely annoying.
If all of this has you wondering about the word dehiscence, in this case, it simply refers to the loss or absence of bone. So the bone that normally sits over the superior canal is dehiscent or has a dehiscence. Dr. Cortez says it's not really known what causes the condition.
We don't really know why it happens. I think some people are born with thin bone, and then over time an incident or a series of incidents can lead to that bone actually disappearing. So now you have one of your balance canals exposed to the brain, which is above your balance system in the ear, and that will cause a variety of these symptoms.
And so when you say people can hear even their eyeballs move, is that actually their eyeballs moving they are hearing, or is that some other noise they might associate with that?
It's their eyeballs moving. Because of this dehiscent canal, your eyeballs, which normally are inaudible to you because of the closed nature of your ear, now become audible.
What's the oddest symptom? Is that the oddest one you've heard of, or what's the oddest you've heard?
That's probably the oddest. I had a patient who, every time he shouted at his children, he became really unsteady and fell over. And I said to him, then stop shouting at your children. He said, you haven't met my children. And he really needed to have an operation because he was extremely debilitated. But I think hearing the eyeballs move, if you hear that as a doctor, and I hope there are a few doctors listening out there, if you have a patient who tells you that their eyeballs are audible when they move them, don't think they're crazy, which unfortunately a lot of patients get when they say that symptom. Refer them on to an ear, nose and throat surgeon, or start thinking about this syndrome as a possible diagnosis, because it's really the only syndrome that can cause that symptom.
So how do you actually fix a superior canal dehiscence? Well, there are 2 methods. Dr. Cortez's approach involves a 2-hour-long surgery, where he cuts out a section of the skull and moves the brain over to the side, all to access the ear and fix the faulty canal from the inside. One day, in the middle of organising this story, Dr. Cortez rang me out of the blue. He said he had a surgery scheduled the next day on a patient with this condition, and he asked if I'd like to come in and watch it and record the sounds. I said yes, absolutely. And that's how I came to meet Bruce the morning of his surgery at Prince of Wales Hospital in Sydney.
My name is Bruce Williams. I'm a farmer from Central West New South Wales. I'm here today because my head is really shitting me.
I asked Bruce how his symptoms started, and I got an answer that I was not at all expecting.
Well, I had ringing in the ear and I had a hearing test and they told me it was industrial deafness. And then I got hit by a cow in the head coming out of a crush, and it done my skull, and then I started to really get bad noises through my skull.
Can I ask how the cow ended up hitting you in the head?
Well, we had backpackers on a property, and when you put them in a crush, they're supposed to put a lever down to hold the head of the cow still, but he didn't put the lever down, and when I bent over to get the tag, the cow come out of the crush and hit me in the head. The cow is now hamburger meat.
It's a funny story, but like with Anne, the condition was having a major impact on Bruce's life.
Well, Bruce is one of those farmer types from Orange who, gets on with it and tried not to let it get to him, and he started getting, pretty debilitating symptoms and, reading between the lines when he was speaking to me and saying things like, I'm just not coping very well, I'm not enjoying life. But, other people have it much worse than I do. So he was trying to cope with it, but you could see that it was really affecting him on a day-to-day level. And a lot of what he did as a farmer involved, mobility and walking, and it just affected his day-to-day activity and his work.
It affects your life because your voice echoes back through your head all the time, and your ears are always like kind of itchy and annoying, and like you can play tunes with your eyes if you wanted to in your skull. And some days your knees and your feet when you walk, you just don't want to walk because of the noise that comes back through your head. It's just unbelievable.
What do your knees and what do your eyelids sound like?
Well, people ask us, it sounds like crickets and that, but it's worse than any of that sort of thing. It's just when you move your eyes, it's popping at the ears. That's what it sounds like. But when you walk with your knees, it just becomes so not painful, but everything seems to go into your skull or your brain, and then it's hit a brick wall and then coming back at you. And that's what it feels like. You're just hearing noises all day long. It's just a ringing non-stop.
Had you heard about superior canal dehiscence before you were diagnosed with it?
No, but I'm glad you can say it because I can't.
It's a tricky one.
But to drive a truck or to drive cars, you can drive for hours, and which I do. I'll hop in a car and I'll just drive because it helps you forget about it. But that's about the only thing that does help you.
Bruce has a dehiscence in both his ears, but only one can be operated on at a time. Today's surgery was meant to fix his right ear, but now he's not sure which ear is bothering him more.
This morning and today my left was, but right now since I've been talking, my right ear is really ringing really badly. So, I really can't make up my mind.
When you move your eyeballs, which ear is loudest?
My right ear is popping when I move my eyes, yeah.
Left and right?
Or both.
Okay, let's go for a walk and see which is loudest with your knees.
In the end, it's decided the left ear will be operated on. Dr. Cortez explains the game plan.
We're going to shave some hair. We're going to make an incision in front of his ear extending up into the hairline. We're going to take a 3 centimetre by 4 centimetre window out of his skull with a drill. We're actually going to be retracting his brain away from that dehiscent canal so we can get access to it. The retraction is around about 2 to 3 centimetres. We're going to find the dehiscence. We're going to plug that balance canal with some bone wax, and then we're going to get some liquid bone cement and place it over the top of the canal to recreate the barrier that he was born with. Then we put the brain back, put the window back, sew him up, wrap his head and finish the operation.
Wow, how risky is a surgery like this?
It sounds very risky. It's actually not. There is a risk of hearing loss. It's around about 10% of patients will experience some permanent hearing loss in the ear. In truth, most of them would gladly give up their hearing for the absence of the symptoms, and the success rate for majority of the symptoms caused by the dehiscence is very, very high.
With that, it's off to the operating theatre. And just so it's clear, Bruce has fully consented to us being there and recording.
Just don't touch anything that's green, and don't touch the microscope. Great, because that's also sterile.
The first thing that strikes me about the operating room is that it's surprisingly crowded with people. There are about 1, 2, 3, 4, 5, 6, 7, 8, 9 people in here, plus myself and our sound recorder, Martin Peralta.
Registrar, anaesthetic registrar, anaesthetist, surgeon, assistant, 3 nurses. The usual crowd.
So it's a big group of people, but people are mostly kind of milling about, chatting right now. Some are prepping the equipment, but yeah, the action hasn't quite started yet. After a bit more waiting, the surgery begins. And for the first little while, I have to admit I'm mesmerized and kind of terrified that I'll accidentally touch something. Thankfully, Dr. Cortez narrated what was going on.
So we've made the incision. We're just stopping a bit of bleeding. The scalp is very vascular, so it does bleed a bit.
Soon, he's cutting through the temporalis muscle, which is what you use when chewing food. To make the cut, he uses a tool that generates an electrical current that burns through the tissue.
And then we're going to split this muscle. And that's the most painful part of the procedure, is when you split the muscle, because every time they chew, it hurts. Scissors, please.
Having never seen a surgery before, I have to say I'm remarkably unfazed so far. Bruce's entire body is under sheets, so the only visible part is the small section of the head that Dr. Cortez is operating on.
It's a bit brutal, this bit.
It makes what I'm seeing feel a bit more abstract.
My least favourite part of the operation.
Less like I'm looking at an actual person.
I feel like you're really hurting the patient when you're doing that.
That said, there's plenty of blood and the smell of burnt flesh to contend with.
Alright, so we're now onto the skull, the bone. So just stripping the muscle off. Alright, so now we have the bone of the skull exposed here. So the next step is to make a window in the skull to get access to the superior canal. Okay?
If you're squeamish, be warned, this is where the drilling begins. It's one of the more crucial parts of the surgery, because you need to drill just enough so that you actually cut the skull, but not so much that you nick the outer covering of the brain, the dura.
You know, we want this to be a external operation around the brain rather than inside the brain, so we try not to pierce the covering, because it does change the operation a little bit if there's spinal fluid leakage.
Luckily, Dr. Cortez has made a clean, square-shaped cut. The dura is untouched.
So this is now the brain, okay? But it's covered, so that's not actually brain, that's the covering of the brain. Okay. And luckily we didn't put a hole in it, which is great. If you put a hole in it, spinal fluid would leak out and then you would see the brain. It's great, thanks.
This outer layer, it looks like a creamy white sheet of tightly stretched tissue. There's none of that pink squiggly stuff you'd imagine from illustrations of the brain. That's underneath the dura.
Alright, so now we're going to put a retractor in that's going to help me retract the brain while I put the bone cement in.
The retractor looks a bit like a clamp.
So we're going to spend about 10-15 minutes fiddling with that. Then I'm going to start going under the microscope, retracting the brain off the floor of the ear bone and trying to find that dehiscence. Once I find it, put some wax in it and then put some bone cement in, and then we're done. So opening takes an hour, closing takes half an hour, and the actual important part of the operation takes about 15 minutes. You know, so, and that's a lot of surgery by that, isn't it?
And that's pretty much how the rest of Bruce's operation pans out. After Dr. Cortez plugs the dehiscence with bone wax and cement, we watch him replace the piece of skull he cut out earlier. Then the muscle and skin is flipped back over, and the process of stitching Bruce back together begins. And then, about 2 hours after it began, the surgery is done.
No one fainted?
No.
No?
And that was surprisingly okay. I think the most confronting part was actually watching the skin being flapped over and stitched together.
Oh, really?
That's the most recognisable.
It is, isn't it? Yeah. And that's all people see is the wound.
Yeah.
And they think, oh, what a neat wound.
Yeah.
And they don't realise what actually went on.
A few weeks after the surgery, I give Bruce a ring to see how he's doing.
Hello, Bruce speaking.
Hi Bruce, it's Sana from the ABC. How are you?
Oh, good, thanks, mate. Yourself?
Good, good. When we last spoke, you were about to go into surgery. So how's your hearing now?
Improved about 70% on the left-hand side of the ear. Yeah, last Thursday I woke up and I had no sound in my ear. Last Thursday morning, it was amazing. It was quite weird. It was kind of funny.
Right, no sound apart from, sounds you actually want to hear, is that right?
No, yeah, like I had no knees or eye noise in my left ear. It was just kind of like I'd lost my hearing. But as soon as I turned TV on or heard people talk, yeah, I hadn't lost my hearing.
Bruce's hearing is still fluctuating a bit in his left ear, though. Straight after the surgery, it felt completely fixed. But as the days passed, some of the noises returned. But overall, it is getting better, he says. Now it's just his right ear giving him problems.
It sounds a lot worse than it was before, but, I think it's because it's the only one that's making the noise now. It's sending me stupid. It's sending me really batty sometimes.
Do you feel happier now that you've had the surgery, or are you still a bit frustrated?
Yeah. If he said that he would do my right ear tomorrow, I would be down there to have my right ear done straight away. Because I thought they were miracle workers. I said that to the doctor the next day. Oh, you're a miracle workers. I've got no noise.
All right. And when we spoke in hospital, you mentioned your whole ordeal kicked off because you were hit in the head by a cow because of some irresponsible backpackers working on your farm.
Yeah.
I'm curious, are you still employing those backpackers? Does that risk still around?
Now. I ran away from it. I left it to my partner. I'm living on the Central Coast now by myself because the injuries and the rest of it just wasn't worth the effort anymore.
Okay,
Yeah.
so no danger of cows hitting you in the head again?
No dangerous cows. No, only dangerous thing now is probably someone throwing a beer glass if I go to the pub or something.
As for Bruce's right ear, Dr. Cortez says the plan is to operate in the coming months. And in the 20 years since superior canal dehiscence syndrome has become recognised as a condition, plenty has changed.
Obviously people had been misdiagnosed for decades before that and had been thought they just had a spontaneous leak out of their ear. They had operations which were ineffective, unsuccessful and complicated. It caused more damage to them. And it was only when people started doing the right investigations that people recognised this syndrome and started treating it effectively.
Do you remember when you first learned about the condition and what did you make of it?
Fascinated. Really didn't know about it until I went overseas in 2000, and it was about 3 years after a guy at Johns Hopkins started describing the syndrome, and the boss that I was working at in Utah at the university had worked with him at Johns Hopkins, and so he was very big on it. So he was getting patients from all around America coming to him for surgery. So we did quite a few. We did probably 40 in that year. Because it was newly diagnosed and he was one of the few people that was doing it at the time. I wrote a paper on it which we published in the Australian Journal. That's how interesting it was to me, and it's really evolved since then. It's not like anything we do in ENT. It's not like taking tonsils out, putting grommets in. Even the other ear operations that we do are usually approached from a different angle. So it's just a really fascinating syndrome and treatment.
How has what we understand about this condition evolved over the last 20 years? You said there's been some changes.
Obviously awareness has changed, and so we're getting better at diagnosing it. We're not perfect, but the delay in diagnosis has diminished. Surgical technique has improved, so the cements have gotten better. So, when I started doing it, it was 45 minutes holding the brain back, waiting for the cement to dry, because you can't have a pulsation of the brain affecting the drying of the cement. So you've got to hold the brain back while the cement is drying. Now it's 8 minutes. So that's better for the patient and less taxing for the surgeon. We've started plugging the canal with bone wax, which I think gives a better result and a more complete result.
What interests you in this condition? Is this a surgery you particularly enjoy performing?
I do. I mean, as a surgeon, you're into instant gratification. And when patients wake up and say, oh my God, my life is better, you don't get that in medicine that often. And that's very gratifying from my perspective. It's also really interesting from a physiologic point of view, from a neurological point of view. It's a unique condition. There's nothing like it. Just the fact that this 3 millimetre lack of bone over one of your balance canals can cause so much trauma to you, can cause so many symptoms that are so debilitating, and it's not technically that demanding to do, but to have the ability to fix someone after they've gone through such a rigmarole just to get a diagnosis. The look on their face when, first of all, they know that they're not crazy, they're not nuts. They can hear their eyeballs move. There's a reason for it. There's a treatment for it. Just to be able to offer them a treatment after so many years of drama getting there, that's really satisfying from my perspective.
These days, Dr. Cortez sees about 20 patients a year who are suffering from a superior canal dehiscence. For Anne Miller, who we heard from at the beginning of the show, about 2 years has now passed since her surgery.
I knew that the operation had worked because everything was really quiet and became even more quiet. And I didn't realise how emotional I was, because when Dr. Cortez came in one day to see how I was, I just threw my arms around him, because it was just, I'm getting teary now. Because, you live in this hell, really, because I was just mad. I should have seen somebody much earlier than what I had.
How has your life changed since the surgery?
Oh, everything's normal. I go exercising, I walk, I've gone back to school, I can teach, I can talk to my friends, love going out for dinner, I can drink. Because beforehand it was like, oh no, I can't drink because I'm already dizzy and falling over. But now I can drink, which is thank God. It's just saved my life and my sanity and my relationships with work and my partner, my friends and family. It's just saved me.
You've been listening to All in the Mind. Thanks to producer Diane Dean and sound engineer Emrys Cronin. Thanks also to sound recordist Martin Peralta, who was with me in the surgery. And thank you for listening. I'm Sana Kadar. Catch you next time.